If you had a toothache, you'd probably see a dentist. If you had a pain in your arm or leg, you'd probably go to your family physician. And yet so many people suffer through some hearing loss and they never do anything about it. And the reasons are many, from cost to appearance to misconceptions. So today an expert from Hearing Health Solutions is here to help answer questions about hearing aids. Carolyn Gelati is a doctor of audiology with Hearing Health Solutions and Ohio ENT. Carolyn, nice to have you here.
Thank you for having me.
Yeah, we are going to talk about some of those misconceptions and things. I'm sure you hear a lot of basic questions from people. What are the most common questions that people have about hearing loss and hearing aids?
Yes, a lot of the most common questions we hear is, A, why are they so expensive? B, do they still whistle? Do they still squeal? My parents have hearing aids and they're huge. Do they still look like that? I don't want something that's ugly and behind my ear. So those are probably the biggest three that we hear on a very frequent basis.
And I know what they're talking about with that whistling.
Yeah.
I mean, I know we have come a long way too in hearing aids, and we'll get to that in a minute. But cost is a big factor for some of these folks. Can we help in some way as far as lowering some of that cost for folks so that they can hear without that huge expense?
It's a good question. There's a lot of different philosophies on how people price out hearing aids, but what a lot of people forget is that when we look at the purchase of a hearing aid, it's not just the device. It's actually the services and everything else that is included in that. And there's a lot of things that people don't know ahead of time because hearing aids are not something that's very commonly talked about in the general population, but the service and everything behind that is all included when you go ahead and purchase hearing aids.
Give me examples of what you cover so that you know that the people who are getting the hearing aid, that the fit is right, probably, that they don't have the whistling and all those sorts of things.
Yeah. So one of the things is, the professional itself. You have to trust your professional that you're working with, but the hearing evaluation, so the testing that we're doing, the hearing aid evaluation, so the time that we take with our patients to sit down and actually talk about what type of device is right for them, what technology is right for them, all of that. That's about an hour process. The counseling on test results, the counseling on communication strategies. We take ear impressions if that's necessary, and then verification measures, of course. When we talk about hearing aids, they're digital technology now, and those are kind of the things that we want to make sure that we get included. The follow-up visits, any repairs or anything like that, that's also all included in what we're doing.
Orientation on how to use and care, that's important too, because people get so confused once they get it home. They may not put it back in their ear because they're not quite sure what to do.
Yeah, and we spend a great deal amount of time making sure that patients, before they leave our office, are very comfortable inserting it, taking care of it, maintaining it at home, changing the battery on about a weekly basis. Those are the things that we want to make sure you're comfortable with as the patient before you leave the office.
Interesting, before we got on camera here, you said that you are seeing more and more younger patients between 45 and 55. And why do you think that is?
I really think that people are more aware of their hearing nowadays, and because as a population we're actually working longer and we're in the workforce longer, people are more on top of their health and they're more aware of what's going on with their bodies and what's happening, and they need to be able to hear in these situations, so they're more amped to do something about it. Now, whether younger we were listening to things,
earbuds in all the time, loud music, all those things.
All those things could also be a contributor, but I think people are they're not waiting the way they used to take care of and manage some of the stuff that they.
That's really interesting you say that. These folks are ready to step forward and find a solution, as opposed to some older boomers who really are resistant to that. And so for some folks who are resistant, how do you get them to come to see you, Carolyn?
That's always a hard thing. We just want to try to encourage people and your loved ones and your family members to be aware of those types of situations where if you do notice somebody's having a difficult time hearing, a lot of times it's the significant others or family members that are getting them in the door at first. But once they come in and see us, they kind of really take their thought process and think about, well, this really is affecting me on a daily basis, and I really do need to do something about it, because it's a quality of life issue. It's not just It's one of our senses.
Right, it's one of our senses. So to help get people into your office, you have a great incentive.
Yeah, so we actually, because cost can be such a big concern, we actually are having a really great offer now. We have $1,000 off of a pair of premium hearing aids, and then $400 off our advanced or standard level devices. So again, just making sure that when you come in, we're getting everybody the ability to hear and kind of offering that out to the public.
And you have lots of locations, so that's a great important factor
Yes,
to you, Carolyn.
yes.
Thank you. Nice to have you here.
Thank you for having me.